মুক্তিযুদ্ধের চেতনা বিকাশে অঙ্গীকারবদ্ধ থেকে বাংলাদেশের সঠিক ইতিহাস, ঐতিহ্য ও সম্ভাবনার নানা ইতিবাচক দিক তুলে ধরার লক্ষ্যে এবং সুস্থ সংস্কৃতি বিকাশের প্রত্যয়ে অনলাইন টেলিভিশন চ্যানেল ইউকেভিডি টিভি ডিজিটাল বাংলার আলোর মিছিলকে এগিয়ে নিতে লাইক, কমেন্ট, শেয়ার করে আপনিও থাকুন আমাদের সাথে। ইউকেভিডি টিভি, here to serve the community.
or who is concerned about a loved one still in hospital today. Unfortunately, we've seen across my area of London, North Central London, the Bangladeshi community have been twice as likely to lose their lives to COVID. And unfortunately, we've seen across London that the highest rates of COVID this time around have impacted Asian communities, which includes Pakistani and Bangladeshi and Indian backgrounds. So we thought it was really important to come together to ensure that we're talking directly to communities, acknowledging some of the deep and entrenched inequalities that have caused that, but that we're here to answer questions and to do all we can as leaders across London to support the community. I think I know I speak for everyone to say how proud we are to represent such diverse communities and to have so many Bangladeshi heritage residents as part of our boroughs. So I'm really delighted that we've got such a brilliant set of speakers to hear from. Her Excellency Saeeda Muna Tasneem, who's the Bangladeshi High Commissioner to the UK and Ireland, Professor Kevin Fenton, Regional Director for London from Public Health, Martin Machray, who's the Joint Chief Nurse for NHS London, Riyad Karim from North Central London, CCG, Tulip Sadiq, the MP for Hampstead and Kilburn, Rashnara Ali, the MP for Bethnal Green and Bow. And we've also got a number of London leaders on this call, Mayor John Biggs, Mayor of Tower Hamlets, Mayor Roxana Fiers, Mayor of Newham, Councillor Hamida Ali, leader of Croydon Council, Councillor Theresa O'Neill, leader of Bexley Council and leader of London's Conservative Group, Councillor Gareth Roberts, Liberal Democrat, leader of Richmond Council. And this is very much a cross-party event that councillors across our city are supporting, and everyone would have loved to be here, but we had to limit the number of places on this panel. The event will mainly be in English, but a translated version will be available, and we'll be able to answer questions in Bangla and Sylheti if people would like that. So I'm going to hand over to Councillor Nadia Shah, who's a cabinet member in Camden, who has been helping organise this event, who's just going to say a few words in Sylheti.
আসসালামু আলাইকুম, আমি সিলেটি ভাষায় একটু কথা কইমু। আমার নাম কাউন্সিলর নাদিয়া শাহ। আমি বর্তমান ক্যাবিনেট মেম্বার কমিউনিটি সেফটির লাগি। আমার দায়িত্ব হইল কমিউনিটি নিরাপত্তা। এর ভিতরেও আমি আপনারা সবার লাগি কোভিডের বিষয় দরিয়া তুললাম। আমি সবাই ধন্যবাদ জানাই যে আপনারা মূল্যবান সময় দিয়ে এই মিটিং এ জড়িত হইছেন। এই মিটিং এর উদ্দেশ্য হইল যে আপনারা সবে এই কোভিড মহামারীর বিষয় নিয়ে সবে সচেতন হইতা। বিশেষ করে আমরা বাংলাদেশি কমিউনিটিরে এই রোগে অন্যান্য কমিউনিটিতে বেশি আক্রমণ করছে। আমরা সবের খুব কষ্টের সময় যার, আর আমরা রেগুলারলি মৃত্যুর সংবাদ পাইরাম। আমি নিজেও খুব কষ্ট পাইরাম এই সংবাদগুলা পাইয়া। আমরা সবে এত সাবধানে চলিয়া গাইডলাইন মানিয়া তো আমরা অনেক লস হয়েছে আমরা কমিউনিটির মাঝে। তারপরেও ঠিক সঠিক ইনফরমেশন পাওয়ার আপনার অধিকার আছে। এর মাঝে কিভাবে আমরা কোভিড রোগী বাসা থাকলে সেফ থাকতাম পারি, টিকার তথ্য করার একটা সুযোগ আছে এখানে। এই চিন্তা করি আমরা চিফ গেস্ট বাংলাদেশ হাই কমিশনার টু দ্য ইউকে এন্ড আয়ারল্যান্ড হার এক্সেলেন্সি সাইদ মুনা তাসনিম আর আমরা সম্মানিত এমপিরা টিউলিপ সিদ্দিক আর রুশনারা আলী আর আমরা প্যানেলের অন্য বিশিষ্ট প্যানেল মেম্বার একসাথে করলাম আপনারা সবের লাগি আমরা গেস্ট উপস্থিত হইছেন আমরা সবরে আমি আপনারা সবরে অনুরোধ করলাম যে আপনারা এই মিটিং এর কোয়েশ্চেন আর আনসার ফাংশনে বাংলায় কিংবা ইংলিশে প্রশ্ন জিগাইবা আপনারা যে জিনিস বুঝার আছে প্লিজ জিগাইবা ধন্যবাদ থ্যাঙ্কস জর্জ
Thank you. And introducing Councillor Hai, who's also a cabinet member in Camden and also been helping organise the event to say something in Bangla.
Assalamualaikum. আমার নাম আব্দুল হাইজ আমি cabinet member for young people policies and cohesion and Camden মাঝে আমরা ফলা pandemic মাঝে আমরা কিছু কাজ করছিলাম around disproportionality একটা রিপোর্ট আমরা করছিলাম করার বাদে আমরা যেমন ব্ল্যাক এন্ড এজিয়ান এথনিক কমিউনিটির মাঝে এই প্যান্ডামিকে বেশি ইম্প্যাক্ট করে ওর কারণে আমরা একটা রিপোর্ট বানাইয়া আমরা কাজ করছিলাম যে আমরা কমিউনিটির ক্লাস সেভ করা যায় আর আজকে যে ইভেন্ট হইলো যেমন আপনারা ইনফরমেশন দেওয়ার লাগি ভ্যাকসিনেশন সম্বন্ধে বা খেলে আপনারা সব আপনার বাসায় বা ঘরে আপনারা ফ্যামিলি সবরে খেলা প্রোটেক্ট করা যায় খেলা সেফ থাকা যায় আমরা জানি এই প্যান্ডামিকে এই করোনা ভাইরাসে আমরা কমিউনিটি খুব ইম্প্যাক্ট হয়েছে ফার্স্ট লকডাউনের মাঝে দেখা গেছে আমরা বাংলাদেশি মানুষ disproportionately মারা গেছে কম্পেয়ার টু অন্য এথনিক গ্রুপস ও অন্য জাতর মানুষ আর আমরা মানুষ বিকজ মাল্টি জেনারেশন গড়ের মধ্যে থাকা যায় কারণে আরো দেখা যায় বেশি এই জিনিসে আমরা কমিউনিটির ইম্প্যাক্ট করা যায় আজকে আমরা এমপি হল আসুন হাই কমিশনার আসুন কাউন্সিলর আসুন আর ইম্পর্টেন্টলি আমরা দুজন হেলথ প্রফেশনাল মার্টিন আসুন কেভিন ফ্যান্টন এন্ড মার্টিন আপনারা আজকে অপরচুনিটি দেওয়া যাইব যেমন আপনারা যখন একটা কোয়েশ্চেন থাকে বা আপনার একটা ইনফরমেশন জানতে চান আপনারা বাংলায় হইতে পারবা আর এরা আশা করি আপনারা কোয়েশ্চেন এগুলা আনসার করবা ধন্যবাদ
Thanks very much, Abdul. So we're really honoured and delighted that Excellency Syed Amuna Tasneem is able to join us, and we really thank you for your support at this time. And I'm going to hand over to you to say a few words. Thank you.
Thank you very much. First of all, I'd like to thank Councillor, Leader of the Council, Councillor Georgia Gold. And also, it's just so great to be on this platform where we have, honourable members of the Parliament from Bangladesh British community, Ms. Tulik Siddiqui and Ms. Rushnara Ali, who are good enough to convince the Bangladeshi community. They do a much better job than I do in convincing them and communicating to them. And I know that so many councillors, regardless of party lines, have joined today, united to give this message in the interest of Bangladeshi diaspora here in the UK. I thank my heartfelt thanks to all of them because I know they would do a much better job than I would in communicating this message. And yet I feel very honored that you have given me a space to speak here on this platform. So I feel extremely, humbled that I have an opportunity to speak to all these, qualified people who are dealing with COVID every day, all of you are like frontline workers and you deal with the community, deal with the caregivers, the doctors, nurses. So a big heartfelt thank you. I would also, like everyone else, pay my heartfelt condolences, and also, my hearts are there with the families and sympathies are there to all the near and dear ones of people who have lost their lives, who've left us due to COVID, and their bereaved family members. I pay a special tribute to Captain Sir Tom Moore, who has just passed away today, a centenarian who's a great role model, great inspiration, sort of a braveheart kind of a philanthropist who has fought Corona, and finally he raised 32 million British pound for the NHS charities, encouraged the young generation immensely to fight and be resilient, but he's passed away. I also take this opportunity to pay my special respects and a standing ovation to everyone at the NHS, all the doctors, nurses, caregivers, health professionals from our community, from the Bangladeshi British community, also like businesses, curry industry, everyone who's risked their lives to save our lives. So, I pay a tribute to them. So, this year has the entire last year and until now, we know that that with the new strain of COVID, we've had more than double the numbers of deaths in just last 3 months than we had in the last 8 months. So this is a new strain of COVID. It's much more infectious and much more vicious. So under the circumstances, we are seeing that there are more deaths in the past 3 months, and Nadia has already mentioned. And my special thanks to Nadia and Abdul Hai. They're the ones who have informed me and asked me to join here. And thanks to Georgia for the invitation. Just coming back to this year, I just want everyone to know that 2021 is a very special year for Bangladesh. It's the birth centenary of our father of the nation, Bangabandhu Sheikh Mujibur Rahman, without whom we couldn't have had Bangladesh. I pay my deep homage to him. This is also the 50th anniversary, that means golden jubilee of Bangladesh's independence. And this I say for all my British Bangladeshi brothers and sisters here. And this is also the 50th anniversary of Bangladesh-UK diplomatic relations. So this is a very special year, and it will be, no matter what, through virtually, we'll be organizing events. And like I have over the past 11 months in any event, whether it was Eid, whether it was Bengali New Year, whether it was Christmas message, whether it was specially message for vaccines, I have reached out to my community as much as I can through video messages, social media, to stay at home, follow the lockdown rules, keep your elderly safe, keep them isolated as much as possible, protect them, and now take the vaccine. So one good news, in the COVID cloud, one silver lining I feel is that, first of all, today, as we speak, the infection rates are 2,700, around that line, which is like 1/3 of what it was on 18 January, which was like 9,000. So it has come down, and RR rate has also come down between 0.6 and 0.9. So there is optimism and hope. But at the same time, today we also had 24,000 infection in all over the UK. But London rates have come down, and yet London is still Greater London is probably still the most infected city. And we know that there are many pockets in Greater London where the ethnic minority communities live, particularly our British Bangladeshi, Bangladeshi diaspora live there. And the good news is that, I congratulate the British government for bringing in the vaccine and rolling it out. I think they have completed 9.6 million with nearly 5 million completing the second dose. And I hope there's a large number of Bangladeshis in that too. And I think they will be able to reach the target 15 February, 15 million vaccines. Now, we know that there are large number of Bangladeshi doctors, caregivers in different boroughs in Greater London who are directly working with COVID patients. I urge upon them, just like I urged upon them to maintain lockdown rules, that please take your vaccine. Have faith in your NHS. My salute to your NHS. I think this is the best NHS in the whole world. We don't have that. There are many nations who are not fortunate enough to have an NHS. So have faith in your NHS, have faith in your GP, and have faith in the vaccine, because we haven't heard anyone who had an adverse reaction from the vaccine, no matter what is the age. And can I just give a salute to Her Majesty the Queen, who is, I believe, 99 who's 96, I think, and the Duke of Edinburgh, who have taken this vaccine. I think they've taken the Pfizer vaccine. So if they can take it, so can you. And I urge upon my, Bangladeshi brothers and sisters that your elderly people who qualify to have the vaccine, whenever they have a call from the NHS, please take them for the vaccinations and keep them isolated unless they take the next dose. Because Captain Moore took the first dose, but he still passed away because he didn't take the second dose. He couldn't. Before that, God has taken him. But I urge upon everyone that, regardless of whatever rumors you hear about vaccines, don't believe in that. Have faith and trust on your NHS and your GP and whatever is recommended by your medical health practitioners and the Public Health of England. And I want to mention here just a little bit that many families have their loved near and dear ones in Bangladesh. Because, we have the Bangladeshi community here, they're very closely linked to Bangladesh. They keep on traveling to Bangladesh. So I just wanted everyone to know, a travel advisory, that, Bangladesh, since the last 5 months, we do not allow anyone to board any flight from Bangladesh to any destination without a negative PCR test. And when they go back from London or any place, they have to take another negative PCR test. And currently with the new strain, we already have imposed 7 days of institutional quarantine, where we do a test on the 6th day, because the new strain is very strong. It actually incubates, the incubation period is less. So on the 6th day, we do a test, and we have been able to contain coronavirus in Bangladesh to a great extent. I don't know, it may be the temperature or resilience of people, but we had so far 8,000 deaths. So your near and dear ones in Bangladesh, they are taking the vaccine, probably taking the same vaccine, because we have procured the Oxford vaccine from Serum Institute in India. And, right now we have, the Bangladesh government has procured 40 million. We have just had arrived about 400,000 from India. And we have probably covered about 30,000 people. It just started yesterday. Our Honorable Prime Minister inaugurated that. But, your near and dear ones are also taking this vaccine. And it's been encouraged, a similar sort of criteria is being followed in Bangladesh as well. Vulnerable people and people who are 70 plus, they're qualified for the vaccine. So at the end of the day, I just want to reiterate that, I am always, as High Commissioner of Bangladesh, in touch with the UK FCDO and our Minister is Lord Ahmed. And we always express our concern about the Bangladesh community. How are they doing? Whether their air connectivity with Bangladesh and UK, everything that concerns our community. So I just want to assure you that we are, from the High Commission, we are also kind of key workers. Like I'm sitting in my High Commission now physically, I'm not working from home. And we try to, this is another message to my community, my brothers and sisters, that for your consular service, try and avoid coming to the High Commission. Please send it to us by post. We are providing 250 plus MRPs and NVRs and all that through post, by email, and only emergency services you can come to the High Commission, but try and avoid it until your national lockdown is over. So we are not taking any new appointments because of the national lockdown. We're following the rules. And at the end, I want to reach out to the community leaders in particular, imams of mosques or religious leaders of different religions in the Bangladeshi community. I think they have a role to play. If they, and the elected councillors as well as the community leaders, elderlies, people do listen to them. Probably they can organize Zooms and advocate people to any kind of fear they have or apprehension about the vaccine can be taken care of by that kind of community. They have much more influence over the people, the community rather than me. But I'm very, very proud and humbled to be able to advocate this here in this platform. Thank you.
Thank you so much, and I wish we were in a room so we could applaud you for that powerful speech. And it's our honour and privilege to have you with us today. Just before I pass on to our next speaker, I realised that I forgot to introduce Councillor Mohammed Butt, who is the leader of Brent Council and leads for London on issues related to equalities and faith. And it's just because you're so important, Mohammed, that you needed your own introduction. So thank you so much for being here. But I'm now really delighted to welcome Kevin Fenton, Professor Kevin Fenton, who's our regional director for London, who has been at the forefront of dealing with the pandemic, done some really powerful work on the disproportionate impact of the disease, and is one of the nation's and the world's kind of trusted and leading figures in this space. So Kevin, we're really proud to have you here.
Lovely. Thank you very much, Councillor Gould. Good evening, ladies and gentlemen. I am so privileged to be here with you this evening to take some time to reflect on the impact of this global pandemic on our lives here in London, to reflect on where we're going with the epidemic and what we need to do as we are emerging through lockdown and looking at yet another year with this pandemic, but also to begin to reflect on glimmers of hope, the emergence of the new vaccine, a better understanding of new variants, and many more tools in our toolkit to address this pandemic. And so for the 10 minutes that I have for my brief introduction today, and I'm looking forward to your questions this evening, I really wanted to just review where we are now with the epidemic in London and what together we should be doing to reduce inequalities and to prepare our communities to be healthier in the year ahead. So as many of you know, London has had a fairly severe epidemic of COVID, beginning in the first wave, which was almost a year ago. And we have just gone through and are going through the second wave of the pandemic. And over this time, over the past 12 months, more than 650,000 Londoners have been infected with COVID. And we have lost more than 14,500 residents and fellow citizens in our city. So this epidemic is real. It has touched all of our lives, family members, friends, colleagues, neighbors. And today, as we face this new phase of the epidemic, it's really important that we are all pulling together, reflecting on those we've loved and lost, but also thinking about how we take full advantage of the opportunities ahead. The lockdown that we have been in since the beginning of January has been effective in helping to drive down rates of infection across the city. And I'm really pleased that tonight I can say that we are seeing fewer and fewer cases of COVID being diagnosed every day compared to where we were at the beginning of the year. But this does not mean that we're out of the woods. In fact, we know that we still have thousands of patients in hospitals across London who are being treated for COVID. And we still have a large number of people in intensive care units across London being treated with severe disease. And we also know that this disease continues to have a severe toll on our communities. And in our experience over the last year, we also know that COVID doesn't randomly affect people, but it is disproportionately affecting those from disadvantaged parts of our community, Black, Asian, and minority ethnic communities, men more than women, and those who are in particular occupations, especially those who have high levels of contact with members of the public or people who are exposed to COVID. So armed with this knowledge, we now begin to have some of the tools to help us to both navigate this pandemic, but also to reduce the stark inequalities that we're seeing in the epidemic in London today. The reality is, with the second wave of the epidemic, we have seen another widening of inequalities of the disease in London. And unfortunately, Londoners of Asian backgrounds, especially Bangladeshi Londoners and Pakistani Londoners, have been at the forefront of some of the severe illness and death in the second wave of the epidemic, followed by Londoners of Black African and Black Caribbean heritage, and then white Londoners. So we're seeing this widening of inequalities as we move through the second wave. So given this knowledge, we are now in a position where we are armed and ready and able to do things differently in this phase of the pandemic. And one of the key glimmers of hope we have is, in fact, the availability of the vaccine. And London has done particularly well, but we have to do more to ensure more Londoners, especially those in the most vulnerable cohorts, get their vaccines and are able to benefit from the highly effective protection that it offers. Today, more than 1 million Londoners have received their vaccines. Among this, a number of Londoners of Black, Asian, and minority ethnic backgrounds. People who are highly vulnerable to the disease, but who understand that being protected is part of their passport of navigating through to the end of this pandemic. So at the moment, we're working across London, working with communities, having really authentic conversations about the vaccine, its safety profile, its content, why it's important, its effectiveness, and what do we know about new variants and how it will interact with the vaccine. Because I believe that is through these conversations, through these authentic connections that we make, whether as leaders in the community, as medical leaders, or as community leaders, it is through those conversations that we will get through this pandemic together. But vaccines are the only key to ending this pandemic. What we have learned over the last year is that following the rules and the guidelines are incredibly important at this time. And as we are in national lockdown, the more that we can stay home, the more that we can work from home or limit our contacts outside of the home, is the more that it reduces the chances for the virus to spread from individuals to individuals. And this is a key part of why our rates are falling now and why we need to go a little bit further to further suppress the virus so we can emerge from lockdown. And in addition to paying attention to the rules, the basics are the same today as they were a year ago. Hands, face space. Ensure that you're keeping your hands clean, covering your face, especially if you're in crowded or enclosed or closed spaces, and of course, maintaining your social distancing. I can't stress enough that these simple measures are things that we all can do to help to prevent COVID from spreading or from introducing COVID into our own families. And what we're also learning is that as we are emerging through the pandemic, these inequalities are not necessarily driven by the fact that some ethnicities are necessarily more at risk because of the color of our skin, but because of some of the social conditions, the real life issues that communities face, whether it's economic disadvantage, living in multi-generational households, living in overcrowded households and settings. These are factors that can increase risk. So a key part of the prevention is understanding how to protect ourselves, how to protect our families, following the rules, and of course, being vaccinated when it's available. So Councillor Gould, with that, I just wanted to say we are still in a very serious phase of our pandemic in London. And as we emerge through this second wave, we must all work together to ensure that we're leveraging every tool in our disposal, every resource in our resource toolkit to ensure that we can get to the end of this pandemic. I sincerely believe, having worked with so many Londoners, so many leaders, and so many community members over the past year, that we will do this together, that our vaccination rates will continue to be, and we will aim for them to be the best in the country, and that communities across our city will become engaged and will become enthusiastic about protecting themselves and their communities from this disease. So with that, Councillor Gould, thank you again for the invitation, and I'm looking forward to the questions this evening.
Thank you so much, Kevin, for those words, and please do put in the chat if you have questions for Kevin. I'm now delighted to introduce Martin Machray, who is the Joint Chief Nurse for London, but most importantly for today has been leading the vaccination programme on behalf of London and the COVID response. So, I mean, Kevin, Martin has been working each and every day and without stopping to try and bring the vaccination programme. So no one better to talk to us about it today. Martin, over to you.
Georgia, thank you. Can I start by saying thank you? So thank you to three groups of people. So first of all, thank you for the people I can see on my screen, the political and civic leadership. Collectively, no matter what party, for what you have done over the past year. It is so important, the work you've done. Our MPs, our councillors, and Your Excellency, the High Commissioner, thank you for your support in this. It is so important we work collectively together on beating this disease, so thank you. And people on the call need to know that the leadership of that group has been superb and unmissable. Secondly, I want to thank all of the Bangladeshi community in London for their support for the rules that have been applied, the discipline that's been necessary to get on top of this awful disease. Londoners collectively have done a brilliant job to live with what are really hard conditions, not what we're used to in this glorious city. But we have done it collectively together. And I want to thank you, and I want you to thank your families, your communities for what you've done. And I want to pay tribute finally to my Bangladeshi colleagues in the NHS and in the care sector. We are always thanked as the NHS, and people come out and clap, and that's lovely. But I've got to say that the Bangladeshi colleagues of mine in general practice, in nursing, in allied health professions, in hospitals, right across the city have been phenomenal with a disease that has truly affected their families and their communities more than others. And yet to continue to try to give care in those circumstances has been truly outstanding. So I want to pay tribute to them. Because in my 35 years, I know I look a lot younger, but in my 35 years as a nurse, I've never been through anything like this. Let's be really clear. I've been through all sorts, awful winters, great pressures, but nothing like the last year. This has truly been a unique event in our lifetimes. And the impact it's had on communities like the Bangladeshi diaspora has been more significant than the wider community, and we need to acknowledge that. And every night, and some colleagues will know I've said this before, every night, one of the last emails I get is a very sad one that says, how many Londoners have died of COVID in the past 24 hours in the hospitals that are in the NHS? And tonight's email, I'm looking across at my screen there, says 105. That's 105 families that have been devastated by this disease. That's 105 communities that won't have their loved ones in their midst tomorrow or when we come out of lockdown. And if therefore I fear I sound overly pushy and energetic about taking the vaccine, you'll understand it's because I'm not trying to tell you what to do, but because as a nurse, I don't want more people to die. As a father and as a son, I don't want people I love around me dying. And therefore it is so important to listen to what the High Commissioner said about taking the vaccine and to share that with your families and with your loved ones. So I want to say a couple of things about the vaccine programme in London. For the next couple of weeks, but then beyond, we are focusing on giving the first dose of the vaccine to those who are most at risk of severe disease and death. That's the over 70s, that's the people who work in care and hospitals and healthcare, that's people who are extremely clinically vulnerable with specific diseases, and those who are residents of our elderly care homes. And some people say, well, Martin, why don't we focus on ethnic groups rather than those age groups? Why don't we focus on the Bangladeshi community or the African Caribbean community or others? And it's because we need to stop and maximize the effect of the vaccine and make sure that those most vulnerable are protected first. And if you're in those groups, you are most vulnerable. And if you're from a Bangladeshi or another Asian country, you are even more at risk. So you want your over 70s in your community to be vaccinated first. You want your extremely clinically vulnerable to be vaccinated first. And that's what we need you to all share with your families and your communities, that this is really important, that those most at risk in your areas get this vaccine and get it now. And it's there for everyone, and we want you to have it. And I realise that people are hesitant. They want to know a bit more. So hopefully we'll answer some of those questions tonight. But we only know what those questions are by listening, so I'll shut up in a minute. But I do want to dispel a couple of quickly dispel a couple of things that we often hear. So one is it all right for someone from a Muslim background or other background to have this? Is there pork or anything like that? There are no animal products whatsoever in the vaccines being used in England. None. So that hand on heart, it's not for me to say it's halal. That's for our religious leaders to take that view. But I can say hand on heart, there are no animal products. This is a synthetically manufactured product. Does it alter your DNA? No, it doesn't. Say that the evidence is out there. We can share that widely with you, but this is not something that alters you as a person. Thirdly, the side effects. You may hear lots about side effects. The most common side effect is you get a sore arm. And the second most common side effect is you feel a bit grotty for a day or two. And that's about 10% of people. Usually men, let's be honest, it's normally blokes who complain about side effects. But we know that the significant side effects, there is only one, and that's for people who are really at risk of something called anaphylactic shock. and those people know who they are already, and your doctors know that. The vast majority of us, the worst you might get is a bit of a sniffle. You won't catch COVID from it, be clear about that. And finally, and most importantly, people want to know it's safe. And I can say, hand on heart, that this is a well-researched, well-understood vaccine that's been developed by experts and regulated by experts who say it is safe. And we can see that in the data, and we can understand that. And I can dispel those rumors that it's not safe and things like that, but we also need to listen to why people feel that. So although we want to vaccinate everyone quickly, I also want to give people time, and I want to give people facts on which they can make their own decision. Because I truly believe that if you understand the facts and you care about those around you, that you will encourage your family to have the vaccine when it's time, and you'll have it yourself when it's offered to you. So Georgia, I'll finish there, but want to reiterate my thanks to you and everyone for joining this conversation tonight. I'll happily answer any questions that people have.
Brilliant. Thank you so much, Martin, for that thoughtful presentation. The next speaker is Riyad Karim from North Central London, CCG. And when we organised this event, Councillor Caliscan from Enfield introduced me to Riyad, who had some research he wanted to share on the impact of the disease on the Bangladeshi community. And we had a very full agenda, but I thought it was really important that we did hear from him. So we've got a couple of minutes to hear from Riyad. So over to you.
Thank you very much. Thank you very much, Georgia. I'm Riyad. I'm the head of primary care for Enfield Borough, NHS North Central London, CCG. It's an absolute pleasure to be here today. I'd like to thank the organisers' leadership for courageously shining the spotlight on this most important issue, that namely of the disproportionate impact of COVID-19, this awful disease, on Black, Asian and minority ethnic communities, including our very own respected Bangladeshi diaspora, and also in the importance of the need to increase the awareness and understand the vaccine, that it is actually safe and effective. It is the best line of defense. We need a call of arms to fight this disease so that we can resume our normal life in the future with our families and our nearest kith and kin. I'd like to also thank Her Excellency, the High Commissioner for Bangladesh for UK and Ireland, for her empathy, concern for the health and welfare of the Bangladeshi diaspora, of which 49.2% of Bangladeshis live in this amazing city, London. In terms of Enfield, where I work, in our, we are also kind of very concerned about this disproportionate impact of COVID-19 on communities. We're taking the matter extremely seriously. We, as our colleagues here in Camden, we have a smaller Bangladeshi population of about 7,000. It's a very young population. The highest percentage is around about 13 to 24-year-old. The population resides in the areas of most highest deprivation on the east of the borough. We have, unfortunately, a disproportionate number, in spite of the relatively small size of the community compared to other London wards. In Enfield, we have quite a disproportionate number of deaths compared to other communities within the Bangladeshi community. So our approach in Enfield is to work very closely. Obviously, I represent the CCG, but in many effect, we're one team with public health, with the VCSE sector, with the communities, through our mechanism, which is the Integrated Care Partnership, to address inequalities like childhood obesity, and also at the moment, the pressing hour of need. It's about how we can together, in a way which is effective, really raise awareness of this vaccine and how important it is. And to that effect, it's an amazing event that you've put on today. We'll be doing a similar event for the Enfield communities on the 17th, and inviting NHS Director of Inequalities, Habib Nakvi, and Marcus Riddle from NHS England to join a panel with insights from Masood Ahmed in the West Midlands and Fazana Hussain in East London and Newham, to see how we can distill and decant and understand how we can improve the way and listen genuinely to the concerns that the communities have, including that of the Bangladeshi diaspora, so that we can actually build a solution, co-produce it in a way which is not paternalistic. This is not about nanny state. This is about helping people to get to the right state of health. And it's a very British thing for us not to be told what to do. It's got to come from within, and I totally get it. We need to kind of make and help you make an informed choice. So I think in terms of and thank you for this opportunity today, Councillor Georgia, to mention Enfield, your near and close neighbour, but your concern for the Bangladeshi community and other communities affected by COVID is our concern. And I really celebrate and I commend this pan-London approach for us to deal with the 222,000 people that represent the British Bangladeshi community. And if I can do anything from Enfield's point of view as an integrated care partnership, then I consider myself an ally to the cause. Thank you very much for the time.
Brilliant. Thank you so much for being part of today's discussion. And now our next two speakers, I don't think need any introduction. They're two amazing women. We're very lucky to have these two leading lights with us today. So the first is Tulip Siddique, the MP for Hampstead and Kilburn. Tulip.
Thanks very much, Georgia, for inviting me to speak here today. And thank you to everyone on the panel for joining us today, and all the speakers, and to the Honourable High Commissioner for joining us as well. I know that the past year has been really difficult for lots of people, and I know a lot of people listening right now have lost loved ones, and my thoughts are with you and your family. It hasn't been an easy time for anyone. And I also want to take the opportunity to thank all the NHS staff who've been working around the clock to keep us safe. And in particular, I hope you forgive me for praising particularly the staff at the Royal Free Hospital, which is in my constituency of Hampstead and Kilburn. And I've seen firsthand how hard they're working and taking risks to keep all of us safe. I know through the casework that I do as a constituency MP and through my role as a shadow education minister, that there is a disproportionate impact of COVID-19 on the Black, Asian and other ethnic communities. And it's especially been disproportionate towards the Bangladeshi community. And I want to make it clear that this has nothing to do with our community not following rules. I've been very proud of our community for wearing face masks, continuously hand washing, maintaining social distancing, not going to visit our elderly relatives even when we've wanted to. Just recently, we celebrated one of my very close family friends' 80th birthday parties on Zoom because we knew we shouldn't all turn up at his house. And I know the community's very much been following the rules, but because of the structural inequalities in the health and housing system, the community has suffered more than most. And together with Rushnara Ali, Rupa Haq and Afsana Begum, I've raised this over and over again in Parliament. As MPs, we know that the disproportionate impact has affected our communities. And we know that we have to raise this in Parliament so people are aware of what the impact's been. But what we simply can't do, and this is the reason we're all meeting here today, is that we can't allow this inequality to increase by us not taking the vaccine. What I will say to you, the vaccine is definitely safe. It is effective. It has been developed by world-class experts, and it is the best protection against getting COVID-19. You would have heard all the health experts before me speaking on the panel, pointing out just how effective the vaccine is and how safe it is. And I would like to reiterate that right now again. I know the vaccine is safe, and I know that I will be taking it as soon as I'm told that I qualify for it. Unfortunately, not just yet. However, of course, you must make an informed choice, and you have the opportunity today to ask any questions that you have about the vaccine. And we want to address any concerns that you have about taking the vaccine, about the effects afterwards, about the products that have been used in coming up with this vaccine, and how it came about, and what research was put into it before it was offered to everyone. We also understand that some of you may be worried about leaving your house to get the vaccine. So I want to reiterate that I know all vaccination centres, including the one that I'm volunteering in, and all the GP surgeries are running in a safe way, a COVID-safe way, which means extra precautions are in place. So you will be protected if you leave your house to get the vaccine. I'll finish off by saying that we've lost enough members of the British Bangladeshi community, and we simply don't want to lose any more people. Please take the vaccine. Please look out for a message that invites you to take the vaccine. Please respond immediately, and please save your lives and the lives of others by following the rules. Thank you.
Thank you very much, Tulip, for those words and for being here. And Roshnara, over to you.
Well, thank you very much, Georgia, for bringing us all together. And it's great to see our friend, the High Commissioner, and it's great to see so many colleagues and particularly our council leaders who've been at the front line working with us as parliamentarians and of course our NHS services. And like Tulip, I want to pay tribute to all our NHS and care staff and all our public servants during this crisis. And in my case, I want to pay tribute to the staff at the Royal London Hospital who've been at the kind of epicenter of this crisis for Londoners. It's the busiest hospital we have in the last pandemic. At the end of the first wave, the hospital expanded with 2 additional COVID wards, and they're often have found themselves in incredibly challenging circumstances. And week in, week out, we're dealing with very difficult situations with many of our constituents, and it's thanks to their efforts across the NHS that so many lives have been saved. But my thoughts are with all those who've lost loved ones. And in the last year, as I'm sure there are 227 participants in this discussion. Like many of you, I have lost relatives, loved ones. At the moment, we have one relative who's still in hospital, and the sense of regret, perhaps, because the vaccine couldn't have come sooner with those who we've lost, is very prevalent in all of us, in all of our hearts and minds, as we think about those we've lost and those who are still battling for survival, who've been hospitalized. My constituency and this borough of Tower Hamlets has been hit very hard, as I know across the city. We've suffered greatly. The British Bangladeshi community, along with other minority communities, as others have said, has been hit very hard. So what we've got to do, and I know all of us in this crisis, across parties, across different backgrounds, have come together to do the best we can against the face of these structural inequalities that blight our cities and the structural racism, frankly, that has been here in our country for a long time. Let's recognize that. Against all of that, we've been battling against those odds. And the vaccine, as others have said, provides this huge opportunity and a way out and hope that we desperately needed. A year ago, none of us could have envisaged we'd be in a position where there's not one, but a number of vaccines now available to protect us and to save lives. So we've got to turn our attention to countering the myths, countering the misinformation, and doing what we can to persuade people across our communities to take the vaccine. It's unfortunately very sad to see that the take-up isn't as high as it needs to be in the Bangladeshi and Pakistani and Black and minority ethnic communities. Now, this is not about blame. It is about needing to understand how we deal with the anxieties and concerns we have, and we've got to do that. But we need to make sure, and all of us have been saying those things to colleagues who are on this call, and we'll continue to do that, that on the supply side, in terms of what the services do, we've got to get better at getting closer to our communities by providing answers to the questions like today, and beyond. Helplines, public information, going into homes where people are vulnerable, and I know the NHS and other services are doing that. Care workers are going in to vaccinate people. We need to do more of that. We need better data, and Kevin and Martin have heard this from us before, and they're going to hear it again. We need better data because as parliamentarians, we don't know the breakdown of by ethnicity yet of take-up. when we get that data, we can really start. We can ring people up and tell them. All of us in this call can ring people up and help you deliver. We're prepared to do those things. We've got to be very practical. And today, what I would say to all 221 of us that are here, let's deal with those things that people feel anxious about, those concerns and questions they have, and make sure at the end of this call, you contact every family member, every WhatsApp group that you have. You know, our community is very big on Facebook and WhatsApp, to reassure them, to encourage them to take up the vaccine as soon as they get their appointments, because I know quite a lot of people haven't taken up their vaccines and they need to. And the final thing I would say is that, you know, on a personal note, I was very fortunate to see that my dad got his vaccination appointment before Christmas. So I personally took him to the vaccination clinic to get his vaccine. In the last few days, we lost two relatives of ours, elderly aunts, friends very close to my parents, and it drives the message home that I can't wait till my mother gets her vaccine, because in the older generation, sadly, we have lost so many loved ones. So we've got to make sure that we don't miss the opportunity. And as we see Ramadan coming soon, we need to make sure we get everybody vaccinated as quickly as possible who are in those vulnerable categories, because we need to get the second vaccine to them before we get to Ramadan, because at that time it's quite difficult. Doctors find it very challenging to persuade some people to take their regular medication. If they have to have their vaccine during Ramadan, the second vaccine, that's going to add another barrier. So we've got to make sure people don't miss appointments, that they take them now so that they get the second one, hopefully before then. Another message for our health officials here, that we've got to increase the supply in London. In the past, the supply wasn't as high as it needed to be, in my view, and it was lumpy, the provision that was coming into London. I'm really glad to see the increasing numbers being vaccinated, but that's the way we're going to be able to get people alongside the communication and reach that we can provide through this network and beyond. So once again, please make sure when you get off this call to contact your loved ones and remind them as soon as they get their appointment to do so. I'm incredibly grateful to and the church leaders and other faith leaders across our community to take the vaccine and to allay their concerns on the faith dimension as well. If you haven't done them, when you've got loved ones who've had their vaccinations, do spread the word, do record messages and put them out on your social media platforms. All of you have followings, all of you have strong networks, please use them. Thank you very much.
Thank you so much again for those powerful words, and I'm really sorry to hear about your loss, and hope that your relative that is in hospital is getting good care, and I'm sure we'll all be thinking of them. So we've had lots of really brilliant and fascinating speeches, and thank you to everyone who's sent in questions. We've got a lot of questions to get through. There are some broader ones about why we got here, and some of the health inequalities that we face, that I'm going to come to in a bit, and bring in some of the leaders on the call. But I wanted to just ask a couple of the specific questions, I think really for Martin and Kevin. I think, Martin, this one is for you. How safe is it to use the vaccine when the testing has been so rapid? Usually testing takes time when it comes to vaccines. Can you give us some reassurance about
Yeah, thank you. There's two reasons why the vaccine has been more rapidly available than a normal drug. So normally from conception, from the laboratory through to giving a drug, it can take years to do that. And one reason it's slow is that vaccine funding has not been the highest priority for universities and for others and for nations, and therefore it takes time to work through the processes. And secondly, the regulation and the steps you take are usually done in a sequence. So you do a small laboratory test, you take the results, you then do a small sample test on humans who are fit and well, you then broaden that out and you do it in sequence. And this time, because it's been such a global emergency, nations have got together and agreed that we need to do these things in a more concertinaed way, to do them more rapidly and invest in them so that we get a solution as quickly as possible. But no corners on safety have been cut. So all the processes that you would normally go through over those years have been followed to this time. And then the approved of the vaccines, first the Pfizer one, then the Moderna one, have been MHRA, which affect that process, and nor should we, because we want to know that independently, objectively, that all the right steps and all the safety precautions and all the data make us certain that this is safe. And all of those processes have unfailingly been gone through and independently checked by this organisation called the MHRA. And it's when it was safe to use in these conditions that we, the NHS, can go, yeah, understand it's safe, and we can give it, but we'll only give it in the restrictions and the license that's been given. So I can hand on heart say it is safe. We've heard that a number of times, and the reason why is because we've had that independent verification by the regulator, and all the research steps have been gone through thoroughly.
Thanks, Martin. And another question I think to you is, it's come up from a lot of people actually concerned about the delay between two doses.
Yeah.
Between the two doses.
You should have invited a cleverer scientist than the bed plans. Let me tell you. Both the Pfizer vaccine and the AstraZeneca vaccine were hands, face, space, and ventilate. So do those things that protect you and your loved ones anyway. The vaccine then kicks in, and we know that it's effective, highly effective. So over 70% effective for both of those versions.
যেহেতু শীতকাল নিকটবর্তী, তাই এই সময় আমরা বাসার ভিতরে বেশি সময় ভাইরাস ছড়াবার সম্ভাবনা আমরা বাসার বেশি সময় কাটাবো, তখন ভাইরাস ছড়াবার সম্ভাবনাও বেশি থাকবে।
Ramadan comes up. It's important to get that second dose in. And absolutely, some people will think that it breaks fast to have that second dose, etc. What we need to do is also work, as we work through Ramadan, that second dose is available at night time and out of hours, and we'll be working with local communities to make sure that's available for those who want it. But we do need those who were inoculated in December, we'll be having it in March. Those inoculated now will be having it in early April. So it's important that we do that. But that 12 weeks, we are told by the expert, is safe. And it wouldn't surprise, I can't be certain, if over time it becomes just one vaccine shot. But for the time being, the regulator says 2 and up to 12 weeks apart. It was said in the chat box, I saw that AstraZeneca have approved that and they are comfortable with it, but they stick to their global recommendation, if possible, do 3 weeks. But we will save more lives, more of our loved ones, if we get that first dose into people's arms.
Two more quick ones, sorry, Martin, and then I'll
time. No, it's,
some other people. People have asked whether they will always have the same vaccine, or would they potentially get a different vaccine for the.
So your second dose will always be the same as the last. So if you had the Pfizer vaccine first, you'll have the Pfizer vaccine second. There's no information yet for us to say whether they're mixable. They're different they're different makeups. So we're going to stick to the same recipe. If you've had one recipe, you're going to get the same one. Boring diet, but very important.
Boring sounds good right about now.
Yeah.
The next question, or two questions that they're linked, is can people without an NHS number or who are not connected to a GP practice get the vaccine, and can people who are housebound get the vaccine?
Yeah, so let's do the first one, second one first. So the housebound are already, GPs are going out now with the AstraZeneca Oxford vaccine, the one that's being used in Bangladesh as well. It's far more mobile. You can physically take the little ampoule with you into someone's home. You can't do that with the Pfizer one just because of the way we have to store it. So now GPs are picking up all their housebound residents and will be making contact, and the district nurse or the GP will be making contact to come out and visit. So there are mobile teams starting to do that already. And we will be encouraging people shortly that if they haven't heard, to pick that up. What we're asking people now to do is wait to be contacted. That will flip quite quickly, and we'll start to, if you haven't heard shortly, get in contact with your GP, who will come out and help you if you're housebound. If you are not registered with a GP, or then you're still able to have the vaccine. What we are trying to do is make it everyone's whether you're homeless or not registered or whatever, everyone qualifies for the vaccine, because it's a public health measure to make sure that you and the community is protected. There are ways we'd encourage everyone where possible to have a GP. So we're taking the opportunity to encourage people to register where possible. And I know some people would rather not for all sorts of reasons, but it really does pay to get good primary care, and we can get people to have that. And virtually everyone qualifies for basic primary care, and we'll make sure that the vaccine is part of that. And we work with local teams to make sure that that's right for it. We'll make sure that we work with the local councils to make sure that those teams are set up for the communities they serve.
Thanks so much, Martin. I might come back to you if there's more questions for you, but I'm going to ask a couple to Kevin.
Yeah.
One question that we've had, I'll just read it out. If home residents are at such a high risk because of occupations, the number of people living at home, relative disadvantage, are we putting all of our eggs in the vaccine basket? What other measures are in place to protect and prevent COVID-19 from having such an impact in killing our communities? So maybe you could talk through the kind of broader public health work that you've been leading, or we've all been leading, to try and protect communities.
Yes, thank you, Georgia, for that question. And you're absolutely right. You know, one of the things I've learned in my public health career is never to look for silver bullets, because there's never going to be one answer to get us out of very complex health challenges or health issues. And in fact, for most diseases, we use what's called combination prevention. In other words, you combine different modalities in order to control the infectious disease. And I think COVID is going to be similar, that where we can, we will aim to have high levels of vaccine coverage. We will continue to promote prevention messages so that people understand the importance of ventilating their homes, social distancing, wearing masks. We'll also encourage people to get tested and to participate in contact tracing and to isolate at home if they're infected. But most importantly, we will work with our partners to address some of the social and structural issues which are driving this epidemic, as well as other epidemics. And this includes some of the structural issues of people who work in jobs that may put them at risk because it exposes them to the disease. people who may be homeless or vulnerable in some social shape or form, people who may be living in overcrowded households, people who may be living in multi-generational households, people who are key workers, who are, again, not able necessarily to stay home, for example, during lockdown, but have to go out to work and who may be at risk. So it's important that we are addressing these issues as well as the vaccine. And that's exactly what we're doing in London. And a key part of the partnership in London is really leveraging all of the assets that we have in local government, in the NHS, in communities, to have that combination approach to addressing this disease.
Thanks, Kevin. And there's quite a few questions about how we deal with the long-term health inequalities, but people have asked also what research has been done to understand why COVID has had a worse impact on Black and Asian communities. And I think many people are asking particularly the Bangladeshi community. And I know that you led a piece of work into this, so it'd be really helpful to share some of those insights.
Yeah, absolutely. So I had the privilege, colleagues, of doing some of the earliest research on inequalities on risk as well as outcomes for COVID for Black, Asian and minority ethnic communities in England. And this work was done during wave 1 of the epidemics. It was done in April, May and June of last year. And at that time, we looked at the data from hospital systems to demonstrate that actually many Black minority groups had high risk of being diagnosed, having severe disease and dying from the infection. And some of the reasons why we saw this high rates of disease was both exposure to the infection. It had to do with conditions such as having obesity, multiple long-term conditions, uncontrolled diabetes, hypertension, lung disease. It also had to do with factors such as living in deprived areas, gender, with men being more likely to have severe disease than women, and depending on where in the country you were living and the exposure to the virus. But the work that we did last year and that many other researchers have now replicated are some of those social and structural factors that I just mentioned: housing, access to jobs, your connection with communities that may be at high risk, factors that may put you to exposure within the community. These are factors that we found in the research, but as colleagues on the panel here tonight will attest to, these are the real world stories of Londoners and the real world stories of Bangladeshis across our city. And specifically for the Bangladeshi community, we know that risk factors such as housing circumstances, living in multi-generational households, large households, jobs that members of the Bangladeshi community may do that may place them at high risk, and the ways in which communities are knit together and socialize and mix can also be a strong factor in increasing the risk of disease. So again, I really want us to realize it is not because of the color of the skin or because of your ethnic group or because of your faith, but it's because of a variety of factors: the way we mix, the way we interact with others, and our exposure to the virus, as well as our ability to take on some of the protective behaviors that will place us at risk.
Thank you very much, Kevin. So I'm going to open up a question to Mayor Fiers, which is: how can councils make vaccines available in community centres and in communities? And what can we do to support the programme becoming more accessible? And I know that Newham are already doing a lot of that work.
Thank you very much, Georgia. And I just want to thank all the panelists, Kevin and Martin in particular, but also the contributions by Rushna and Tulip, and also Her High Excellency. In terms of the work that councils are doing across London, and this is a pan-London effort, we're working as one, we absolutely know the vulnerabilities and risks that our ethnic minority communities across every single borough are facing. And we know that this is a large part as a consequence of those enduring and long-standing health inequities and structural issues of discrimination and racism that have existed for too long and are being challenged. And I want to just really convey that point very forcefully here on behalf of all leaders here, that we are advocating on issues of disproportionality facing all ethnic minority communities, including the Bangladeshi community and other ethnic minority communities that are in particular disproportionately impacted. In terms of councils, We're scoping out and working with the NHS. The NHS is coordinating the vaccine rollout across all the regions. We're working very closely with NHS London, and within sub-regional levels, we are working with our partners, with the clinical commissioning groups, and in the NUM context, the NUM CCG, to identify and maximise and optimise the number of community centres, GPs, that will be available, and pharmacists that will be available to be able to distribute and provide the vaccine provision available to all members of our community. In Newham, we're working very closely with our GP surgeries and making sure that of those really great practice GP surgeries, that practice is disseminated and improved across all our GP surgeries. And we've introduced vaccination availability through the booking system as part of the national rollout through 2 pharmacies. And today we announced that in terms of our support for those residents of ours that are being isolated, we're going to be providing them some significant support in the context of providing them hotel provision if they need to be isolated and it's difficult for them to isolate at home. In terms of vaccinations, we've established a vaccination peer support network of residents that are being provided information about vaccination to combat some of the myths that are very much circulating in the community arena, and also to ensure that people are very much informed. And we are making sure that we are providing that reassurance messages about the importance of the vaccination rollout programme, and how we will do whatever we can to support communities to be able to get vaccinated, with a particular focus, obviously, in light of the prioritisation that the government has set, in line with the advice of medical experts and the JCVI that Martin mentioned earlier, that for the top 4 priority groups, which are the elderly, and we've got to make sure that we're reassuring our elderly members of the community. My mum and dad fortunately had their vaccines over the last couple of weeks. My father first, because he just turned 80 in early December, my mother on Friday. And as a daughter living with my 2 elderly parents, I feel very relieved and reassured, and needing to restrain my father from wanting to walk around like a cat, because notwithstanding the vaccination jab that he's received, he's going to still need to be very careful over the immediate 2-week period after his vaccine. And as Martin and Kevin have said, we're going to be needing to contend with COVID-19 living over the coming months, and it's important that in addition to the vaccine, we maintain that adherence to all the other things that we need to be doing as part of that public health response. So local government councils across London are working as one, and we are absolutely advocating to ensure that we get sufficient vaccines for all members of our population, and we absolutely are prioritising the importance of keeping our ethnic minority communities and the Bangladeshi community safe. Thank you, Georgia.
Thanks so much, Roxana. Now, I've had a request to answer the question about whether the vaccine is safe, if it has any side effects, and if it has animal products in Bangla and Sylheti. So, Nadia, maybe if you could start, that would be amazing.
So একটা প্রশ্ন আছে যে কোন অ্যানিমাল প্রোডাক্ট ইউজ করা হয়নি ভ্যাকসিনেশনের মাঝে। আমরা এক্সপার্ট হলো না প্যানেলের মাঝে তারা কনফার্ম করছেন যে কোনো অ্যানিমাল প্রোডাক্ট ইউজ করা হয় না ভ্যাকসিনেশনের মাঝে। আর আমরা কোনো আরেকটা জিনিস আইসিল মনে হয় আগে যে আমরা কোনো ডিএনএ এফেক্ট হয়নি, চেঞ্জ হয়নি। আমরা ডিএনএ কোনো এফেক্ট হয় না, আমরা ডিএনএ চেঞ্জ হইতো না। So repeat করাম যে এই ভ্যাকসিনেশনের মাঝে কোনো পোকো প্রোডাক্ট নাই।
Abdul?
যেমন কোয়া গেছে এটার মাঝে জু আসেনি, যেমন কোনো পোক আসেনি বা কোনো সাইড এফেক্ট আসেনি। তো যারা প্রফেশনাল, যারা NHS, Kevin and Martin, তারা কইছেন যেমন যে এটার মধ্যে কোনো ফোক না বা এটার মাঝে কোনো যেমন আপনি নিলে হেলথ ওয়াইজ কোনো ইম্প্যাক্ট আপনার হইতো না। সো তারা সবে রাখি যে ভ্যাকসিনেশন এটা নিলে আমরা সব মানুষের লাগে বালা, প্লাস আপনার নেই যদি আপনি আপনার নিজরে প্রোটেক্ট করবা, প্লাস আপনার যে পরিবার আছে, গরের মানুষ আছে, এরও প্রোটেক্ট হইবা। তারা সবই এনকারেজ করে আমরা সব ভ্যাকসিনেশন নেওয়ার লাগে।
Thank you very much, Abdul. And now I've had a couple of questions about misinformation and fake news. What's one from somebody watching on YouTube who has asked how to communicate with elderly people who are affected by fake news, how to reassure elderly family members not to be afraid of the vaccine. Councillor Butt, I'm going to bring that to you.
Georgia, thank you very much for that. I think that is a really valid point, because I mean, one of the things that we all have in our hands, right, is nowadays is the smartphone, and the amount of misinformation that can be spread quite easily, right, through WhatsApp messages and everything else. First and foremost, honestly, I would say to you, right, check the author, right, who's sending you the information, because that's critical, because if it's coming from just one of your friends or colleagues who are just passing things on, or if it's coming right from a trusted source, like the NHS, the council, or a charitable organisation that is trying to give you the information, right, the right and correct information, and that is verifiable. You can check it, and you know who the individuals are, and also, there's so much misinformation when it comes to people sending articles out, because things have changed quite significantly, and we also need to make sure we check. Is it an old article? Is it relating to something else? That's one of the things, right, that all councils have been trying to do in trying to counter some of these myths. And if you go to the NHS website, the government website, or the council's website, you'll find a whole host of up-to-date, relevant, correct information, right? That will give you the reassurance, right, that what Professor Kevin Fenton or Martin Machray are actually saying is the truth, and we should not rely upon WhatsApp or Instagram as the main source of information. We must make sure we know where it's coming from. Read beyond the headline. So sometimes the headlines are the most misleading part of anything that's sent across to all of us. And once again, and the last thing I would always say, ask the experts. You can always pick the phone up, right? You've got great people here as well today. You've got Roshanara, you've got Tulip, Roxana, you've got Nadia, you've got Abdul here as well. They are the community champions, right? They are working for you. Pick the phone up, send them an email, ask them, is this right? Is this correct? And further on, you can always contact your GPs, because that's always the port of call, right, that can give you the most relevant, up-to-date and factual information that will keep us all safe and your loved ones safe as well. Thank you.
Thanks, Councillor Butt. And Councillor Roberts.
Thank you. Yes, so one of the places to go to is to trusted source, and I had a lady who was quite elderly who came up to me in the streets, because I'm known in my local community, and she told me that she wasn't going to have the vaccine because she'd heard somebody saying something on Jeremy Vine or some similar radio show. And then a couple of days later I saw her, and she said, "Oh, I'm going to have it now, Councillor Roberts." I said, "What changed your mind?" She said, "Well, I saw that Sir David Attenborough had it." So it's the people that are known and trusted, and so they've got no bias. They're not there to sell anybody anything. So if you listen to the people within your community who are there, known and trusted by you, then they are the people to listen to. So point people in the direction of people like that.
Brilliant, thank you. Now I'm going to ask, actually to finish, I think go to everyone on the panel and ask a question that's come up time and time again from the people putting questions through, which is what can we do in the future to take on the health inequalities that have led to the disproportionate impact we're talking about today? what needs to change as a result of this pandemic and everything we've seen. So I'm just warning you that is coming round. But just before I do, while everyone's thinking about it, I just asked Martin one last question that I see has come up. So people are saying that that there's a couple saying that they are maybe have underlying health conditions, or they think they might be on the list at some point, but they haven't been contacted yet, and asking for advice about what to do. Okay,
so if you're over 70, we have been saying, wait, we will call you. It is very reasonable now that if you haven't been offered the vaccine and you're over 70, to call your GP. And I did that for my father-in-law this weekend, who hadn't been contacted, and he was on the list. Of course he was, but I needed, as a son-in-law, to be reassured, and that was a reasonable thing. Many people with severe clinical conditions will know that they are already recognised as extremely clinical vulnerable, and they're in that same position. Many people with diabetes or long-term breathing conditions will be on the next set of priorities, but they're not extremely vulnerable, and it's a fine balance, I've got to say. But we are working through systematically, and if anyone's in any doubt, just speak with your GP and they'll take you through that. That's what your general practitioner is so good at, understanding you and your health needs. Don't overwhelm them. Don't all go and ring them first thing at 8 o'clock tomorrow morning, but do check, and they'll take you through that. And if you're due the vaccine, they'll let you know.
Brilliant. So to the question about what and just short answers, because we don't have ages left, but what can we do to address some of these issues in the future, starting with Councillor Ali.
And thanks, Georgia, and thanks so much to you and Her Excellency, the High Commissioner, for getting us together for this important conversation. And I did just want to pay tribute to our Asian Resource Centre in Croydon, who I know are on the call and have run so many similar sessions like this with hundreds of Croydon residents from our Asian communities in particular, to be building confidence in taking the vaccine. So thanks so much to them. In terms of the question on health inequalities, our Director of Public Health in Croydon often talks about how communicable diseases like COVID-19 really thrive on existing inequalities. And we've reflected a lot, haven't we, in the last year about how our experience of the pandemic has really exposed that structural inequality and racism that Mayor Roxana talked about earlier. And I think one of the most important things that we can do is make sure that that focus on existing inequality doesn't fade away as we overcome this vaccine, and that we maintain that laser-like focus on trying to tackle that structural inequality. And particularly thinking about the experience of Bangladeshi communities in London and in this country, we're so often on the raw end of that deal in terms of jobs, housing, health, income, access to really good jobs. And that's why the data that Roshanara talked about earlier is so important. That's why having that data is really important in being able to tackle inequality. And the Mayor of London, Sadiq Khan, has been campaigning amongst others to make sure, for example, that we're monitoring ethnicity of death certificates. Colleagues in the chat were asking about, how many Bangladeshi people have died from COVID-19. Well, we can't always tell that information because we're not collecting the right information to make sure that we're really holding government and others to account on tackling inequality. And I think certainly in Croydon, our Croydon Health Services, our Croydon University Hospital are working closely with ourselves and the council around what we can be doing, both as service providers and importantly as employers, to make our contribution to changing the outcomes for our residents for the long term.
Thank you so much, Hamida, for that. Roshanara, I wondered if you wanted to come in on this.
Yes, thank you. Well, it's such a big question, isn't it? Health inequalities. And I would start with the macroeconomic situation. Over the last 10 years, we've seen a decrease in funding in the National Health Service, and especially in primary care. And in terms of the pandemic, we've also seen a reduction, the evidence was there, of about £1 billion worth of support in the primary care infrastructure in our country. We need to rebuild that. We kind of need a sort of equivalent to the post-war response in terms of public services, in health, in housing, in education. Young children are going to be really badly off because of what's happened in this pandemic. Depression and mental health problems have gone through the roof. So this pandemic has exposed the historic inequalities, but not only do we need to invest in the health service, we need to invest in care, we need to invest in primary care in particular to tackle those inequalities in our communities. And then we need to rebuild, to learn from the lessons of what's happened in terms of resilience in our systems, to make sure that a future pandemic, and as we can see, there are many variants coming, so it's going to be an ongoing problem that we've got to live with. We've got to respond to the current crisis and what it's exposed, but also the historic ones. And the final thing I would say is about what we do ourselves, of course. The state has got a responsibility. We need investment in those systems, and better, as Councillor Ali has said, better jobs and opportunities, and better housing is a big issue in London, of course, and overcrowding has really hurt our communities, especially in constituencies like mine. But in terms of what we need to do as a community, is we need to increase greater awareness around exercise and healthy living, healthy eating, all those things that we all do what we can to promote. We need to redouble that effort to deal with obesity and work hand in hand with the health services and health sector to try and change behaviour as well. And that's the spirit in which I think everyone's worked recently, but we need to redouble those efforts so that we ensure that the services are well funded, but then well equipped to address those inequalities together with our communities.
Thank you so much. I said I was going to go to everyone, but I don't think we have time for that. So we're just going to have 2 brilliant answers on behalf of the whole panel. So thank you very much for that. So we're 2 minutes away from the end of the session. We are all of the information from today is going to be translated and shared. And Nadia is just going to say something about that.
আজকের সব ইনফরমেশন আমরা আসলেও বাংলায় আমরা সব আনসার দিতাম পারছি না, কারণ সময় একটু শর্ট হয়ে গেছে। কিন্তু আজকের যে মিটিং হয়েছে এটার ক্লিপ অফ অল আমরা সোশ্যাল মিডিয়া ট্রান্সলেশন করিয়া বাংলায় দিমু, যে বাদে আপনারা বুঝতে পারবা বালা করিয়া যে কিতা হয়েছে খোয়া হয়েছে মিটিং এর মাঝে। কয়েকটা 2-3টা ইম্পর্টেন্ট পয়েন্ট আমি আনসার দিলাই। একজনে জিজ্ঞাসা সাইড এফেক্টস এর কথা। সাইড এফেক্টস আসলেও থোড়া আতর বিষয় তো পারে, একটু বেমার লাগতে পারে 1-2 দিন, আর একটু সর্দি লাগতে পারে, কিন্তু মেজর সাইড এফেক্টস কিছু হইতো না ভ্যাকসিন দিলে। আমরা সব এমপি, তারপরে আমরা এক্সেলেন্সি হাই কমিশনার যারা আসুন এই কলের মধ্যে সবাই কইরা যে আপনারা যদি ভ্যাকসিন অফার করা হয় আপনারা প্লিজ ভ্যাকসিন লইবা। ভ্যাকসিন আপনারা না লইলে তো আমরা প্যান্ডেমিকও হতো না, আর আমরা নিজরে আমরা ঠিকভাবে লুক আফটার করাম না, আর আমরা যারা যারা কাছে খান্দাত আছে আমরা ফ্যামিলি সবরে আমরা সেফ রাখতাম পারতাম না। সো আমরা যদি সবে এই মেসেজটা শুনি, ঠিকই আগে কইছেন যে ফাইন সাইন না আর কোনো বাঙালি মানুষ মারা যাইতা, রুশনারাও তাইন কইছেন যে আমরা সবে মিলিয়ে একটা এনএইচএস ওর লগে একটা কাম করতাম, এনএইচএস বিল্ড করতাম হইব, আমরা যারা আমরা আন্ডারলাইং হেলথ ইস্যুস আমরা ডিল করি এই জিনিসগুলা। বিভিন্ন জাতের অনেক জাতের জিনিস আমরা হয়েছে, কিন্তু আমি খাবার করতাম পারতাম না কারণ সময় শর্ট। সো আমরা এইগুলা ক্লিপস অফ আমরা ট্রান্সলেট করিয়া পাঠাইমু সোশ্যাল মিডিয়া। সো প্লিজ আপনারা দেখুন যেন। থ্যাংক ইউ সবাই যারা আইসন আর আপনারা সময় দিচ্ছেন।
Thank you so much, Nadia. And I know that there are still more questions that people have. So if it's a question about your own circumstances when you're asked to get the vaccine, then you can then please do talk to your GP, because your GP is there to answer questions. So you can approach your local council, and every council will be doing lots of events like this to ensure that all questions from the community are answered. So this is just the start of answering questions, and we've taken a note of all the questions here, and we'll be feeding them back to the leaders to ensure that there are answers given. Rashna, did you want to come back in? I just wanted to check with Her Excellency if you wanted to say any words at the end.
Thank you very much. Actually, I learned so much, so I have nothing to add, but there's two particular questions from Bangladeshi students in the UK, and they asked us how can we help them. So, we have organized repatriation flights for Bangladeshi students. Our 24/7 helplines are there. There's a personal email of the High Commissioner. You can, if you have any problems regarding your visa or any of the assistance that you need to reunite with your family or any of these issues, travel issues, please email me in my personal officer. There's an email. If you go to the website and Facebook, you'll get that. And if you're not registered with your NHS, I think Mr. Martin said that you should immediately, anybody who's visiting here with a visit visa or a student visa has a right to register with the NHS and you'll be qualified for the vaccine as well. I just want to touch upon one issue is that I want to reach out to the community again and request Rushnara and everyone, I'm going to do it, my job as well, to alert the British Bangladeshi media, because all Bangladeshis who speak in Sylheti, they listen to these medias. And I think this media should definitely give the message of access to vaccine, why they need to take the vaccine, any kind of apprehension. Definitely we should be utilizing the British Bangladeshi media. So I don't know if they've joined today, but we can definitely reach out and I can also give message. But one thing I wanted to understand is that I've heard about inequality, but everyone has equal access to NHS. Everyone has equal access to vaccine. Then where is the inequality? I'm still trying to understand it, that where is it? So perhaps it's the lifestyle, it's the lack of awareness. Like Rushna has said that, we need to create awareness amongst our community about health and fitness. Perhaps there's high rates of comorbidity. I don't know these answers, but I know that everyone has equal access to education and health in the United Kingdom. In Bangladesh, the government has given a very targeted stimulus package to vulnerable people, and that way our deaths and COVID infections are very low. It's the same Bangladeshi community, it's the same ethnicity that's in Bangladesh that is here in the United Kingdom. Then why is it that their vulnerability would be more than the Bangladeshis in Bangladesh? This is something that we need to look into, but I think that through the Bangladeshi media, we should reach out as to how people should transform their lifestyles and be more fit and build resilience and immunity, what kind of vitamins they should take. This kind of advice, definitely I can encourage the British Bangladeshi media to do so. I think that's a great way of reaching out to the community. Thank you.
Thanks, Commissioner. I think that the research Kevin and others on this call have done has shown that it is to do with other kind of more economic factors, so housing that people live in, where there's a lot of overcrowding, and the jobs that people do. So people are more likely to being on the front line where they're more exposed to the virus rather than kind of choices that they're making. So it's those kind of more structural inequalities that have led to this really unfortunate situation, and those are the changes I think that we need to collectively make long term. Well, we've gone over a little longer, but I think it's been such a powerful session. So I want to just say a huge thank you to everyone who's been part of making this happen. All of the council leaders in London who supported it, our two brilliant MPs here today, our public health and NHS colleagues, Her Excellency, and Nadia and Abdul who did so much, and Ash Ali, who's another one of our councillors, to organise this behind the scenes. We're really grateful and hope everyone found it useful. Have a wonderful evening. Take care.
Thank you, Georgia, for chairing and organising as well.
Here.
Thank
Brilliant.
Thank you.
Stay safe, everyone.
যেহেতু শীতকাল নিকটবর্তী, তাই এই সময় আমরা বাসার ভিতরে বেশি সময় কাটাবো। তখন ভাইরাস ছড়াবার সম্ভাবনাও বেশি থাকবে। এই ভিডিওটি দেখলে আপনি বুঝতে পারবেন কিভাবে প্রতিদিনের নিয়মিত অভ্যাস, যেমন হাত মুখ ধোয়া, মুখে মাস্ক লাগানো এবং 2 মিটার দূরত্ব মেনে চললে করোনা ছড়ানো নিয়ন্ত্রণ করা যাবে। কোনো ঘরের ভেতরে 24 ঘন্টারও বেশি সময় করোনা জীবিত থাকতে পারে। কোনো জিনিসে করোনা ছড়িয়ে থাকলে সেটা স্পর্শ করলে ভাইরাস আপনার শরীরে আসতে পারে এবং অন্য লোকের কাছেও যেতে পারে। সবসময় সাবান পানি এবং স্যানিটাইজার দিয়ে হাত পরিষ্কার রাখলে এই ভাইরাসে আক্রান্ত হওয়ার সম্ভাবনা কম থাকে। আমাদের শ্বাস প্রশ্বাসের সময় নাক আর মুখ থেকে যে ছোট ছোট পানির কণা বের হয় সেগুলোতে করোনা ভাইরাস থাকতে পারে। মুখোশ দিয়ে নাক মুখ ঢেকে রাখলে বাতাসে পানির কণার সাথে ভাইরাস ছড়াবার সম্ভাবনা কম থাকে। শ্বাসের বড় পানির কণাগুলো অন্য মানুষের ওপরে বা জিনিসপত্রের ওপরে পড়তে পারে। 2 মিটার দূরত্ব মেনে না চললে পানির কণা থেকে ভাইরাস ছড়াবার সম্ভাবনা বেশি। ছোট ছোট পানির কণা বা অ্যারোসল বাতাসে অনেক সময় পর্যন্ত ভেসে থাকতে পারে, আর ঘর থেকে বাতাস বের হওয়ার পথ বা ভেন্টিলেশন না থাকলে অসুবিধা হতে পারে। তাই আপনি যখন পরিবারের সদস্য ছাড়া বাইরের লোকের সাথে থাকেন তখন আপনাকে অবশ্যই 2 মিটার দূরত্ব বজায় রাখতে হবে। বাসার বাইরে যেখানে ভেন্টিলেশন বা বাতাস চলমান আছে সেখানে ছোট ছোট পানি কণার মাধ্যমে ভাইরাস ছড়ানোর সম্ভাবনা কম। হাত ধোয়া, নাক মুখ ঢেকে রাখা এবং সামাজিক দূরত্ব মেনে চলা, এই 3টি নিয়মিত কাজ ভাইরাস ছড়ানো নিয়ন্ত্রণ করতে খুব সাহায্য করে। মনে রাখবেন, আপনার যদি করোনা ভাইরাসের লক্ষণ দেখা দেয়, যেমন শরীরে জ্বর, নতুন করে ঘন ঘন কাশি হওয়া, খাবারের স্বাদ বা ঘ্রাণ নেয়ার ক্ষমতা লোপ পাওয়া বা বদলে যাওয়া ইত্যাদি হয়, তবে 119 নম্বরে ফোন করে বা NHS UK'র ওয়েবসাইটে যোগাযোগ করে বিনামূল্যে করোনা পরীক্ষার ব্যবস্থা নিন। আমরা সবাই মিলে ভাইরাসকে নিয়ন্ত্রণ ও সংক্রমণ বন্ধ করতে পারব। ভুলবেন না, হাত, মুখ, দূরত্ব